This segment of It's About You was sponsored by Hudak Dental.
Even now, there are things all around you that can bring a smile to your face. But if it's hard for you to smile because of an issue with your teeth, you want it taken care of as quickly and safely as possible. Alexa Lee found a way for you.
We're all learning to manage things online, over the phone, or through virtual visits. But if you truly have an emergency, and in this case, a dental emergency, you have to know what your options are, right? So Dr. Nina Baghai is joining us from Hudak Dental, and she's here with some help. We need you. Good to see you, doctor.
Good to see you too. How you doing?
Doing well. So I think, first of all, it's important to talk about what constitutes a dental emergency.
Sure. So basically, a dental emergency can be anything that would threaten your life. So let's say you have a cavity you haven't taken care of and it's turned into an abscess. An abscess is pretty much a bunch of white blood cells that are kind of manifesting as the infection, and they're trying to work their way out of your body. For some people, that's not a big deal if it finds a way to drain into your mouth out of the tooth, but for other people, it can cause some really big swelling called cellulitis. And at that point, it can become a medical emergency. So our goal here is to make sure we treat that before it becomes a medical emergency, because we want to keep people out of the emergency rooms, especially at times like these, as best as we can.
So is there a way to treat it without going to the emergency room? I mean, it might sound silly, but...
No, it's completely valid. So oftentimes we want to capture these things and try to do consults with our patients so we can get them on the appropriate antibiotic and get them referred to an oral surgeon or another specialist who is taking patients on an emergency basis. So more so, it's going to be kind of triaging and making sure we can temporarily get their symptoms under control and get them referred to the correct provider so that they don't end up in that situation.
Okay, so doctor, you have a very unique service, and I just want to make sure everyone understands it's free to anyone, to everyone, and it's Ask the Dentist tool. Tell us about that.
So you don't even have to have dental insurance. You don't have to be a Hudak patient. We're here to help you guys. Basically, it's a tool you would use your computer to access. You would give us a little bit of information about yourself and what's going on, and you can even attach a picture. And basically, you would communicate through by our email, and then we could even contact you by phone or figure out what's best for you to get you taken care of.
Okay, so this service, Ask a Dentist. Now, that's, as you mentioned, that's just for triaging, and it's almost to ease people's worries, I guess you'd say.
Absolutely. Make them feel more comfortable, feel better about the situation, and give them good advice that can help them get out of whatever problem they're having.
Okay. And, I feel like all of our daily habits have changed tremendously, but I just want to give you a platform to talk about the importance of keeping really good hygiene and keeping up with everything in your mouth during this time.
Absolutely. So it's really important, you guys, to make sure you're still brushing, flossing, taking care of your teeth, making sure that everything looks great. We know that everyone is very frustrated. We are too. All we want to do is make sure that our patients are happy and make sure that they're well taken care of. And I know it's incredibly frustrating for those of you that have had your appointments canceled, rescheduled so many times, especially for something like a cleaning. What most people don't realize is with the cleaning, there is a ton of aerosols and liquids and fluids that are going in the air. And we want to make sure we keep you healthy. So make sure you still brush and floss, and we'll be more than happy to see you once we can.
Okay. And so for people who have had those appointments scheduled, if they're not in, excruciating pain, you would recommend maybe just reschedule.
We'll definitely be in contact with them to make sure we get their care taken care of properly and keep them on the proper schedule. Our goal here is to make sure that people are safe and healthy, and we'll be able to provide them as best as we can.
Okay, Dr. Baghai, thank you so much. And for all of our viewers, you can go to hudakdental.com for all of the information. Thank you so much for all of your time and for everything you do for us.
Thank you so much for having me here today.
And it was great having you with us